Welcome to the second part of our discussion. Now, before we proceed, let us first review on the definition of health by the WHO. According to the organization, health is the state of complete physical, mental, and social well-being and not merely the absence of disease. We have discussed earlier that our ultimate goal should be the creation of a sustainable and lasting health systems without leaving anyone behind. Now, we can use community organizing as a tool in order to achieve that goal. Community organizing is the process of gathering people together around their shared problems, mobilizing the resources of the community in order to come up with a solution to address the existing problems in the community. Now, all of these capture the essence of health promotion. Health promotion is about enabling people to take control over their health. Health promotion is actually not a new concept, but it was only in the Charter that the role of health promotion in preventing diseases and addressing the general causes of diseases was realized. And to date, the WHO uses the Ottawa Charter for Health Promotion as reference. Now, we will discuss further health promotion in a little while. Let us first define some terms. Health education. This is the continuum of learning which enables people to voluntarily make decisions, modify behaviors, and change social conditions in ways that are health enhancing. Program planning, on the other hand, is a process in which an intervention is planned to help meet the needs of a specific group of people. Now, this is the model of health promotion. As you can see, health education is within the confines of health promotion. In some references, health education and health promotion are sometimes used interchangeably. But if we look closer into it, these two are actually different. As defined earlier, health education is the continuum of learning which enables people to voluntarily make decisions, modify behaviors, and change social conditions in ways that are health enhancing. Health education focuses primarily on improving health literacy, meaning it aims to provide health information and knowledge to individuals and communities. And through this health information and knowledge, the goal of health promotion is to influence the behavior of the individuals and the community towards health. An example is this, the communication of information concerning conditions affecting our health. Example is the communication of the DOH about tuob or health inhalation. So, as you can see in this infographic, nagbigay lang ng information si DOH about tuob and the dangers and risk of performing tuob in this time of pandemic. Now, health promotion, on the other hand, is different in the sense that it is more comprehensive. Comprehensive siya kasi multi-sectoral ang health promotion. Multi-sectoral meaning it involves different key players, and each key player has different roles to perform. So as you can see in the model of health promotion, it is not only social, it is not only political, but as well as economic and environmental. So encompassing ang health promotion. Health education mainly focuses on health literacy. Health education is a part of health promotion. Now, the WHO has three pillars of health promotion. These are the good governance, health literacy, and healthy cities. Good governance requires policymakers to include health implications in all decisions that they take. according to the WHO, the policymakers must promulgate laws and create policies that will prevent people from being sick and being injured. Now, in the Philippine setting, do you think health is an agenda of many lawmakers? Or is it only the concern of DOH? What do you think? Now, this brings me back to this news. This bill was pending in the Senate since 2013. The Pandemic and All Hazards Preparedness Bill or Act, which was proposed by the late Senator Miriam Defensor Santiago. Now, nakabinbin lang siya sa Senate from 2013. If only this law was passed, I believe Philippines would have been more prepared for the pandemic. Not being political ha, but I wonder when will health be a major agenda among the lawmakers? Would it be better kaya if a health worker is part of the Senate? What do you think? Anyway, let's proceed to the second pillar, which is the health literacy. Health literacy pertains to staying informed, so individuals and communities can make informed decisions when it comes to their health. Now, what do I mean by informed choice or informed decision? Kindly pause this video for a while to read this Facebook post. This is an accurate example of a poor decision making because these individuals are misinformed. They base their decision on what their silingan told them. Kasi sinabi ng silingan na magtuob lang kasi mas delikado sa hospital, kaya ayun, nagtuob lang sila. But if this family only gathered enough information, they could have decided well. If they were properly informed, kung alam nila yung risks and benefits of tuob, adequate information ha, if they know enough information and they still resort to tuob, at least there will be no regrets in the end. Kasi they have good basis on their decision. But in this case, regret is what they can only afford at this moment, nothing else. And lastly, healthy cities. Healthy cities pertains to the strong leadership and commitment, no, at the municipal level or at the local government level, no. Strong leadership and commitment is essential to healthy urban planning. Through strong leadership and commitment, we will be able to build preventive measures for the community. And so walay pagdapig-dapig, allow me to flex Davao City's performance in this pandemic. It may not be the best, but I bet most of you will agree that Davao City is doing well in fighting against COVID. That is because of the strong leadership and commitment shown by our city mayor. Now imagine, if cities are healthy, eventually the country becomes healthy. And if all countries are healthy, ultimately the world will be a healthier place to live. Do you agree? Okay, now we can say that health promotion aims to engage and empower individuals and communities to choose healthy behaviors and make changes that reduce the risk of developing diseases and other morbidities. Now let's proceed to the priority action of the Ottawa Charter for Health Promotion. As I have mentioned earlier, the WHO uses the Ottawa Charter for Health Promotion as their reference. So the Ottawa Charter priorities are to build healthy public policies, create supportive environment, strengthen community action for health, develop personal skills, and reorient health services. In relation to this, these are the different types of health promotion programs that can be implemented in the community. There can be activities on health on information dissemination, activities on health appraisal, activities that would change lifestyle and behavior of the community members, or pwede din magkaroon ng worksite wellness program, and of course, i-include din ang environmental control programs because as we know, environment is a determining factor for the health of an individual. So now let's proceed to the steps in health promotion program planning. Now, the steps in health promotion program planning are almost the same with the steps of community organizing kasi pwede nating gamitin ang community organizing as a leverage in order to successfully implement health promotion programs or activities in a particular community. Ang community organizing kasi does not only focus on health problems. As I have said, madaming problems existing in the community. Health is one. Now, in order to resolve those problems, you can use community organizing as a tool. Now, if there are health problems existing, we can use health promotion program as a solution to help address the existing health problems. Now, before we can implement health promotion programs, we can start with the basic community organizing muna. And then after which, yung mga activities na ide-design natin is aligned in the health promotion program. So, ganon. Pwede nating gawin ang ganon. Now, the steps of health promotion program planning are number one, understanding and engaging. This means that we have to get as much information as necessary about our target population of health promotion program. 'Di ba sabi ko kanina sa community organizing, it is important to involve the target population kung gusto nating maging successful yung mga activities na i-implement natin. Now, in order for us to really address the existing problems of the target population, dapat meron tayong enough information about them. Example, our concern is pediatric health. Now, we have to know the different factors that will affect pediatric health so that the activities, so that our health promotion activities will be aligned and will be holistic ang approach. So, ganon. Second class is assessing needs. It is important to assess the needs and wants of the target population in order to identify clearly the health problem existing and also to prioritize these problems para naman ma-maximize yung resources available. 'Di ba sabi ko nga kanina, ang dami-daming problema na nag-e-exist sa isang community at saka hindi posible na lahat-lahat ng problemang yon is ire-resolve natin ng sabay-sabay. Dapat one problem at a time ang resolution. Kasi, yung resources natin are limited lang din. So, kaya we have to assess properly kung ano talaga yung health problem existing in the community, tapos i-prioritize natin ng maayos para yung resources natin is hindi siya maaaksaya. Next class is to set goals and objectives. Na-mention natin kanina that goals and objectives must be set so the program will have a direction and purpose. 'Di ba? Yung goal is kung ano yung gusto makamit at the end of the program. Ang objectives naman are the steps taken to achieve the goal. Now, remember that when crafting the objectives, dapat SMART ang objectives. SMART meaning S, specific, M, measurable, A, attainable, R, realistic, and T, time-bound. Okay, para mas klaro, okay, I have here an example. Kunyari, target population natin are pregnant. Okay? And the existing problem identified is the increasing number of gestational diabetes. Gestational diabetes is a form of diabetes mellitus existing during pregnancy. Now, the goal set is to reduce the number of gestational diabetes cases in the community in year 2021. Okay? Now, the time frame is from June 2020 to June 2021. So, 1 year ang duration ng health promotion program. Now, if you are to design an activity, pwede kang magbigay ng lecture. Now, for this activity, dapat merong objective. And 'di ba sabi natin that the objective must be SMART, specific, measurable, attainable, realistic, and T, time-bound. So for the sample activity lecture, the objective is to conduct a 3-day class on proper nutrition and healthy lifestyle during pregnancy to at least 30 pregnant in Barangay Mandug on July 23, 2020. Okay, so let's start to dissect kung SMART ba ang objective na ito. S, specific. Specific ba ang objective na ito? Yes, it is specific because it states that it will conduct a 3-day class. So it's a lecture and then meron siyang specific topic on proper nutrition and healthy lifestyle during pregnancy. Specific din siya kasi nagbigay siya ng minimum number of participants, at least 30 pregnant. Specific kasi merong location, which is the Barangay Mandug, and on specific dates, July 21 to 23, 2020. M, measurable. Measurable ba ang objective na ito? How do we know that this objective will be achieved or is successful during evaluation? Now, we can use an assessment tool for that. An assessment tool for this type of activity can be in the form of attendance. So through the attendance, we can measure if the objective has been achieved. So kung sa attendance, makikita natin na at least 30 ang nag-participate na pregnant women. Therefore, we can say na, ayun, na-hit natin yung target natin. So ganun siya. A, attainable. Attainable ba ito? Of course, this is very much attainable. We can ask a lecturer for this to give, pwedeng nurse ang lecturer natin, or pwedeng barangay health worker, or pwedeng OB ang gawin nating lecturer for this. R, realistic. Realistic ba? Yes, of course. Because what we're trying to achieve here is a reduction in the number of gestational diabetes in the community. And this objective can be realized. Pwede siya nating ma-implement, no? And then lastly, time-bound, yes. The activity is set to be conducted on July 21 to 23, 2020. So, ganun siya, class. Okay? I hope it's clear. Now, after setting goals and objectives, you develop an intervention. Again, intervention are different activities that are that can be used in order to address the existing health problems in the target population. And after developing an intervention, of course, implement these activities. After implementing this, dapat ha na whenever mag-implement ng activities must be within the scheduled time frame. And lastly, evaluation of results. Na-mention natin kanina na evaluation may take place in all parts of the program. It can be done during the planning and implementation. Tawag natin doon formative evaluation. If the evaluation naman is conducted after the implementation of the intervention activities, we call that as summative. So, pwede tayong mag-evaluate during the process of implementing kasi para nga ma-optimize natin yung intervention activities natin or implementation process natin para we can make necessary changes if possible. Or pwede nating i-stop yung intervention activity na yun kung ma-project natin na low yung kanyang success rate. Now, pwede din ang evaluation right after the implementation of the activities. So, at the end of, yung tulad ng ginagawa natin sa SOLS, pag meron tayong activities, di ba, nag-evaluate tayo right after the activity. So, we call it as summative. Now, again, evaluation is important in order to determine if the goals and objectives are achieved. So, um, that ends our discussion on community organizing and health promotion program planning. As I have mentioned, the steps of community organizing and health promotion program planning are almost the same, no? Kasi we can use naman the community organizing as a tool in order to implement health promotion program in a particular community. Now, to summarize our discussion, community organizing is a process of bringing people together so they can discuss and identify the problems existing in their community. And consequently, they can take action about these problems. Second, community organizing is different from community development because community organizing requires the presence of usually outsider of the community to guide the community members in identifying and crafting solutions for their problems. Community development, on the other hand, occurs when the community is stable and organized enough that the members form their own organization and do the problem solving on their own. Third, health promotion is a process of enabling and empowering individuals to make informed decisions about their health. Health promotion, in contrast to health education, is multi-sectoral. It involves the participation of various key players, including policymakers and the community members themselves. And lastly, the steps of community organizing can be likened to the steps of health promotion program planning. Community organizing can also be used as a leverage for implementation of health promotion program in a particular community. So that ends our lesson for this week on community organizing and health promotion program planning. If you have any questions, kindly post them in our content discussion forum. Thank you for your time and for your attention.